we've got a procedure today, prostatic embolisation, which we're doing in 2 male dogs that both have cancer of their prostate, which is very sad. And when that occurs, the urethra, the tube that they should pee out of, gets obstructed. So our plan today is to go down via either a little nick in the skin here or in the groin and try and access the artery that supplies that tumour, and see if we can put some little special beads in there to stop the blood flow. So embolise the blood flow and hopefully kill the tumour in that area, and then wake the dogs up and hopefully they can pee. We've got Joe Pilton, who's our specialist radiologist, who is going to do all the magic in the background. I don't know if Joe can point out where the tumour is on the CT.
So we've got, here's the dog's urethra, which is the tube from the urinary bladder to the outside world, and then here we've got the prostate, which is abnormal and partially mineralised, which is a common feature in prostatic tumours. And we can see that it extends partially into the neck of the urinary bladder, and then we've got some distension or dilation of the ureters, which are the tubes from the kidneys to the bladder, where the urine passes from to get to the outside world. So we've got a little bit of an obstruction or partial obstruction there, but hopefully with some resolution or improvement in the tumour burden, that will reduce in size as time goes on.
So we're excited because David Benz is a human specialist in interventional radiology, which is what this field is coming to also join us again today. So hopefully between the 3 or 4 of us, we'll help these puppies. So we've got Forrest in here now, and Jerome and Najette are getting him prepared for a CT. So what are you giving to Forrest at the moment?
So we're just giving Forrest some propofol and the yeah.
And then we'll pop these tubes, or one of these tubes, Jerome will pop down the airway just to keep him asleep with the anaesthesia. We'll show you some pictures of him, I think on his back or his front?
On his front.
On his front. And hopefully we'll highlight the imaging and get this procedure started.
So yeah, we just finalized our procedure on Forrest. We could get into both prostatic arteries and embolize them selectively, which is the goal. And we could preserve the vesical artery. We see how he will recover, but hopefully we're going to be fine, and we're going to have a nice result in the end in regards of tumor shrinkage.
We're very lucky to have David join us today. He's one of the human specialists that joined us previously, so it was all his magic.